Welcome to the Mortuary Masterclass, brought to you by the Champion Company, where preservation meets purpose, and every step is part of your journey to safer solutions. For over a century, formaldehyde was the backbone of embalming, reliable, familiar, and undeniably effective, and we're grateful for all that it gave us. But as our profession evolves, so must our understanding of the chemicals we use every day. In today's episode, we explore glutaraldehyde, not as a total replacement, but as a progressive alternative that deserves a serious, science-backed seat at the table. So let's begin. Let's take a quick trip back to the 1950s. That's when glutaraldehyde first hit the scene. It didn't make waves in funeral service at the time, but in the healthcare world, it was a total game changer. Hospitals, dental offices, surgical centers, they were quick to make the switch from formaldehyde. Why? It worked faster, required less volume, and lowered exposure risks. Even outside of healthcare, it makes moves. Take leather tanning. Glutaraldehyde-treated leather is softer, more flexible, and doesn't get brittle. It creates a longer-lasting, more supple-feeling final product. The same goes for prep room outcomes. But let's clear something up. One of the biggest misconceptions about glutaraldehyde is that it's not safe. So instead of opinions, let's look at the actual numbers. The real lab-tested journey. On a regular embalming with no ventilation, just standard conditions, we're looking at 30 plus ounces of 6% arterial, 32 ounces of 16% cavity. Exposure levels? Between 0.05 and 0.06 parts per million, ppm. Now take a more complex case, still no ventilation, 36 plus ounces of arterial, 48 ounces of cavity. Exposure still stays under zero point 0.1 parts per million. For context, the ACGIH safety range for glutaraldehyde is 0.05 to 0.1 parts per million. So every test landed inside or below that limit. And with proper ventilation in place, levels often drop so low they can't even be picked up by badge monitors. Glutaraldehyde also shows up in a number of other industries as a preservative and antimicrobial. It's used in kaolin slurries for paper coatings, concrete admixtures, latex paints, commercial printing inks, and even silicone emulsions, usually at concentrations between 0.1 and 0.5%. It's also commonly used as a microbiocide in cooling towers to control microbial growth, including serious threats like Legionnaire's disease. In veterinary applications, glutaraldehyde has been used for treating hooves, managing mange, and sanitizing egg farms, hatcheries, and incubators. And in lab environments, it's a preferred fixative, especially in cytochemistry and histology, for preserving tissue samples. It's even used to preserve transplant tissues during transport and storage. If you'd like to learn more about its role in embalming, we cover that in another episode of our Mortuary Masterclass, so be sure to check it out for a deeper dive. Now let's talk about exposure concerns and health effects from the worst-case scenarios in embalming. In a tight 12 by 12 prep room, with no airflow and an open container of 2.5% glutaraldehyde, after 15 minutes, 0.02 parts per million. After an hour, 0.01 parts per million. After 17 hours, still only 0.06 parts per million. Even when a full bottle of 15% was spilled, 15 minutes in, 0.04 parts per million. 1 hour later, still 0.04 parts per million. When 2 bottles were spilled, with no ventilation, the peak was just 0.08 parts per million. Once cleanup and ventilation kicked in, it dropped to 0.02 in under an hour. So while its powerful glutaraldehyde is also predictable and controlled, a steady companion on your path to safer practice. But what about long-term safety? Here's the straight talk. Is it a carcinogen risk? Glutaraldehyde is not considered a carcinogen by the EPA, ACGIH, NTP, or any regulatory or advisory agency. Formaldehyde is classified as a carcinogen by virtually every agency in the world. What about skin sensitivity? Glutaraldehyde is a known skin sensitizer, and in rare cases, it can cause contact dermatitis, usually after repeated exposure and poor hygiene practices. Most reports have come from healthcare settings. often tied to the use of thin latex gloves. In contrast, these issues are rarely seen in industrial environments where proper PPE and safety protocols are in place. It's also worth noting that glutaraldehyde doesn't significantly absorb through the skin, and if any does, the body metabolizes and eliminates it quickly. And importantly, there's no cross-sensitization with formaldehyde. There have been a few scattered reports linking glutaraldehyde inhalation to asthma-like symptoms, but these cases are rare and haven't been replicated in animal studies. In fact, no research has confirmed a true immune-driven hypersensitivity, which is what's needed to diagnose actual occupational asthma. One large study involving 340 nurses who regularly worked with glutaraldehyde found no clinical evidence of asthma or respiratory sensitization. Interestingly, only one nurse showed a glutaraldehyde-specific IgE response, while nearly 20 tested positives for latex sensitivity instead. When it comes to genotoxicity, glutaraldehyde has shown some mutagenic effects in a few lab-based studies using bacterial cells. But when tested on live animals, the results have been consistently negative. So under normal use conditions, glutaraldehyde is not considered genotoxic in real-world settings, even though it's more tissue-reactive than formaldehyde. Like most hazardous chemicals, glutaraldehyde can cause irritation if inhaled, but with proper ventilation and hygiene, the risks are minimal. Most safety guidelines set exposure limits between 0.05 and zero point 0.1 parts per million, and noticeable irritation, like eye watering, throat discomfort, and nasal burning, typically begins around zero point 0.3 parts per million. At higher levels, especially around 1.0 parts per million, the irritation becomes much more severe, and immediate action is needed to stop exposure. Fortunately, glutaraldehyde has an extremely low odor threshold, often detectable at just 1 part per billion, which means you can usually smell it long before it reaches harmful levels. On top of that, its low vapor pressure in water-based solutions helps keep airborne levels very low under normal use. Glutaraldehyde exposure during embalming is typically very low. Even without ventilation, levels from standard 2% solutions, whether in use or from a small spill, stay below 0.05 parts per million. With proper ventilation, exposure often drops to undetectable levels. Recent tests with modern cavity fluids containing up to 15% glutaraldehyde showed similar results when standard safety practices were followed. Formaldehyde, on the other hand, has a higher odor threshold, and staying within exposure limits can be more difficult, especially without good airflow. Both chemicals require proper PPE to prevent eye or skin contact. Spills should be cleaned up using recommended neutralizers. Environmentally, glutaraldehyde breaks down quickly, within 48 hours in oxygen-rich systems, so it doesn't persist in wastewater. Formaldehyde also degrades, though it's typically used in larger volumes, which can increase overall exposure. So why isn't glutaraldehyde the norm yet? Honestly, habit. There are a few myths still floating around like, it doesn't embalm. False. It's a phenomenal fixative. Just ask the leather industry. It's banned in Europe. Nope. Formaldehyde has way more restrictions. It's why we use nitrile gloves. You should be using nitrile either way. Latex just doesn't hold up. All things considered, every journey has a turning point. Despite both glutaraldehyde and formaldehyde having similar chemical characteristics and both being effective embalming agents, glutaraldehyde has lower overall exposure impact during embalming operations. It's proven, practical, and smart when used correctly. It helps embalmers honor the dead while protecting themselves in the process. And this isn't about abandoning what worked in the past. It's about building forward with balance. So whether you're experimenting with blends, reevaluating your protocols, or just exploring new paths, glutaraldehyde deserves a spot on your bench. Thanks for tuning into this special edition of the Mortuary Masterclass. Until next time, keep doing what you do best, championing the prep room with purpose, because embalmers matter, and every step forward is part of your journey to safer solutions. That's the champion difference.